Hello, my name is Kelly Jones, and I am the EMS for Children Coordinator for the Illinois Department of Public Health. I'd like to share with you how we developed a virtual survey process for our Pediatric Facility Recognition Program here in Illinois. The Pediatric Facility Recognition Program here in Illinois began in 1998, and as of today, we have 108 participating facilities that span 11 EMS regions. We have included a map of those EMS regions for reference. We conduct surveys on a 4-year cycle, with 2 to 3 regions being surveyed annually. Due to the pandemic, the Illinois EMS for Children decided to utilize a virtual platform to continue our Pediatric Facility Recognition Survey process. To begin, we had to define a secure webinar platform, and we did this by leveraging our state-licensed Cisco WebEx system. Next, we had to develop the virtual survey process guidance documents for both hospitals and surveyors. These documents included checklists as well as expectations for a virtual survey. We then held multiple education sessions for hospital personnel and for hospital surveyors, where we reviewed the survey agenda, we discussed the survey prerequisites, and we defined the documents that needed to be submitted pre-survey, as well as those that needed to be available electronically during the survey. Finally, webinar platform tests were conducted to help familiarize facilities with the WebEx platform to ensure electronic sharing capabilities and to also troubleshoot any issues. We've included a graphic in the middle of the poster which illustrates the checklist of documents that are requested prior to survey. Please take note of the list of emergency department pediatric patient visits that were requested. Currently, Illinois EMSC has conducted 47 virtual surveys and 5 post-survey follow-ups. A virtual survey consists of the opening session, in which the hospital presents their demographics, quality improvement processes, pediatric disaster preparedness processes, their self-identified strengths, weaknesses, opportunities, and threats, as well as a pre-recorded video of their emergency department, including pediatric equipment and supplies, and video of any inpatient area where pediatrics are admitted. We then move on to 4 simultaneously run breakout sessions that occur for document review with the surveyors. While these sessions are going on, the WebEx is electronically locked to help provide confidentiality of any PHI shared or discussed. There is a surveyor huddle then for sharing of the findings and preparation of closing remarks that follows those document review sessions. We end with a closing session, which is recorded to help ensure accurate capture of the surveyor comments, as those are included in a post-survey letter to the hospital. We've learned that while in-person surveys are ideal, the virtual survey process went well, has applicability for future hospital follow-up, as well as provided us a means to stay on track with the renewal process and assess compliance with state administrative code during a pandemic. This was a labor-intensive process for both the state and the facilities surveyed, as additional preparation was required, education and training had to be developed and conducted, guidance documents had to be developed, and additional document review was required. We did utilize surveyor observations and hospital feedback to refine the process as needed as we completed each region's surveys. Thank you very much, and I hope you've enjoyed our poster.